It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak in the nation. In just a few moments, we're going to cut into the briefing at the Sejong government complex with simultaneous interpretation available in English. We're going to go now into the briefing room where Yoon Tae-oh, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So especially with the sudden outbreak of the second outbreak of the COVID-19 in the Itaewon area of Seoul, it would be the Director General is going to update us on the latest number of infection cases, especially those that are related to that case. And it looks like official Kim Gang-lip has taken to the podium to update us on the situation.
Let us now begin our regular briefing for May 15th, Friday. As of today, midnight, we have newly confirmed patients amounting to 27. And in relation to club at Itaewon, 17 were related to this Itaewon club. And the total stands at 148 as for the Itaewon club related cases. And 5 of them were imported cases. And we also carried out over 1,000 cases of diagnostic testings as of yesterday. And as of midnight today, the total number of confirmed cases now stands at 11,018. This includes, of them, 9,821 have been discharged following full recovery. So we have a treatment rate of 89.4%. And we had no additional fatality, with the death toll now standing at 260. Today, this morning, we held a KCC meeting presided by Health Minister Bang Neung-hoo, and we discussed the issues on the Itaewon-related cases, as well as the high-risk community centers and the civil service exam for 5th grade civil servants. Minister Park also said that with the Itaewon club cluster infection, we are facing increased challenges, but our public is strictly complying with our daily quarantine guidelines. And he also added that anyone who are suspicious of the COVID-19, we need to report to the authorities as soon as possible. And by doing so, he said we could claim victory in this prolonged war against COVID-19. At the KCC meeting today, in relation to the Itaewon club cluster infection, we touched upon the issues of the patients and the outbreak among the municipal governments, as well as their joint efforts. And we are utilizing the information, including the mobile traffic, the credit card usage, and the CCTV surveillance, as well as our cooperation with the police agencies in order to track down the patients as well as contacts. And we are also intensifying monitoring and crack down against nightlife administrative orders that have been put in place. And we are also considering these administrative orders to be increased by the municipal governments going forward. However, we are still witnessing a secondary and tertiary infection starting from these club infections. And if we have a delay in the process of identifying the patients, we believe that it will be difficult for us to maintain our current system to respond to the COVID-19 outbreak. So therefore, it is of utmost importance to identify the patients at an early stage. And we also ask the members of the public to cooperate in our screening testing, as well as the epidemiological testings, investigations as well. And we are also providing testings free of charge to non-documented foreign immigrants, foreign workers, that is. So we also advise you to get tested as soon as possible. And in Incheon, we have 2 additional cases in relation to the Itaewon club case, where these 2 patients did not know of their infection, and they went to the church services. And the Incheon City carried out the investigation for 470 people at the churches, and aside from 5 of them, all of the rest were tested negative, and we were able to decrease the number of newly confirmed patients here at this specific church because this church also abided by the quarantine measures, including keeping distancing as well as screening of the testings. And out of the 300 people from this church out of 1,000 total, they also joined the services online, and they also carried out a very good quarantine measures as well. So these were the reasons of such decrease in the number of the confirmed cases. And likewise, if we continue to carry out these quarantine measures in daily life, we are able to curb the further outbreak. And until we have an effective therapeutic and a vaccine against the virus, we can never say that the virus, the outbreak has been terminated. And we also continue to see a high possibility of prolonged outbreak, and we need to carry out such quarantine measures in order to have our national healthcare system to be able to manage and control the outbreak. And to this extent, we also continue to help ask our public to stay at home if you are feeling sick, and please carry out the good quarantine measures that are also given out to each and every one of the public through the 5 infection prevention rules. And if you are also utilizing multi-use facilities that are indoors, we also advise you to comply with the quarantine measures and guidelines, and we also advise the businesses to go through these measures and strictly abide by these measures going forward. Next is about the high-risk facilities, especially for nursing hospitals and mental hospitals and long-term care centers. The government, up until now, we have identified the high-risk community centers, and in order to curb a further outbreak within these community centers, we have had an intensified monitoring for these hospitals and facilities. And we have been monitoring their health conditions on a daily basis, and we have been communicating closely with the personnel who are working at these facilities. And if someone has returned from overseas, we have limited the infection sources from outside by having this person to go on self-quarantine and so forth. So if we have another suspicious outbreak in the nursing hospitals, we have increased our coverage of the national public health insurance so that these hospitals do not go through difficulties. And going forward, in order to further curb the sources of infection, we will make sure to have an effective scheme to go over these high-risk facilities, and we will also continue to carry out the screening testings for these facilities as well. And as for the newly administered patients, starting from today, we will also carry out their investigations and the testings of COVID-19 testings, and they will be expanded to coverage by the national health insurance. And 50% will be covered by the public health insurance or the local government budget. And meanwhile, we have been putting on a ban on the visitors to these nursing hospitals and long-term care centers, and we believe that many are disappointed as they are unable to visit their patients, and the government is currently monitoring the situation in a complex manner, and we will be rolling out measures to enable these visiting and visitors and in a safe environment. And next is about the social distancing in daily life measures, and as we have a prolonged outbreak going forward, we are also trying to effectively manage the situation by implementing a social social distancing in daily life. And we also established, starting from mid-April, a pan-government team with the experts of different circles, and we are also monitoring and coming up with measures in order to carry out successful and effective quarantine measures. And as of the 19th of May, we will have a fourth round of such meeting, and we will be regularly monitoring the situations of the outbreak, and we will also be reviewing the status of the quarantine measures put in Itaewon district, and we will also go through our current distancing in daily life. And if any of these guidelines need improvement, we will be going through such matters in this meeting. And as we are witnessing a warmer temperature, many of the indoor facilities, including schools and dining areas, are going through the guidelines for the use of air conditioning, and these will also be dealt with during this meeting. And the government had originally planned to conduct the civil service exam for 5th grade civil servants on the 29th of February. However, it has been delayed, and it will be carried out during this weekend. And about 11,000, that is 11,000 people have been applied for this testings. And also we will have a self-reporting system so that we could have and manage and control over the conditions of these applicants. And also we have enabled the test takers who are on self-quarantine to have different test sites to carry out their testings. And as for the people with symptoms with COVID-19, we will also have them placed in a designated room, and also we will decrease the traffic of these people at the same place, and we will also minimize the maximum number of people inside a classroom to 15, and we will be going through measures to decrease the risks of infection. And we also will dispatch about 303 people and civil servants who will be monitoring the quarantine conditions of these applicants. And this is the start of the public and national exams, and we will continue to resume these exams going forward. We ask all of the applicants and test takers, as well as the monitors, to comply with the quarantine measures so that we can become a model for the worldwide international community. And this evening, we will have a health minister meeting together with the China and Japan, and these meetings will be held virtually. And this meeting will be an opportunity for the South Korean government to share our know-how and expertise, and as well as our innovative measures for quarantine, including walkthrough centers, as well as increased screening of the entrants from overseas. This is the first of such kind between the three nations since the outbreak of COVID-19, and we believe that it will be a great opportunity for us, for the three countries, to share our experience. And we would like to take this opportunity to establish a scheme for a cooperation going forward in order to combat the outbreak. COVID-19 is a disease that can spread very fast to others, including my loved ones as well as my neighbors, even though I myself do not have symptoms. If you do not comply with the quarantine guidelines set forth by the quarantine authorities, you can be the spreader of the virus. Therefore, it is very important to keep to the guidelines, and it's also very important to get tested if you show symptoms. And we have witnessed how the COVID-19 outbreak could also be continued, and we also have continuously managed the situation to a certain extent. And as for the students, we have been preparing for the reopening of the schools and a phasal. However, we have been delaying this once again, and we are also seeing that many children and many of our students are also becoming responsible agents of quarantine. And we believe that adults, we need to show great models for them so that they can emulate. And as you did so far, we ask the members of the public to continue to cooperate in our quarantine measures going forward by showing a sense of unity and cooperation. Thank you very much.
지금부터 질의응답 시간을 갖도록 하겠습니다.
That was a live briefing you just heard there from the South Korean health authorities updating us on the COVID-19 situation. We just heard that there were 27 additional cases of COVID-19 in the country, bringing the total to 11,018. There were no new deaths, meaning that the death toll stands remaining at 260. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us. We'll be back shortly with our regular newscast at 12 p.m. Korea time. Bye for now.